Good evening, everyone. Just making sure that you all can hear me because I see Dr. Joshi is there. Good evening, everyone, and welcome to the Cook County Department of Public Health Ask the Doctor broadcast, where leading doctors from Cook County take questions from Cook County residents directly. It's hard enough to get to your doctor. And in these times when there's so much information going on, so many developments, almost daily, hourly, by the minute, we want to make sure that we bring doctors to you virtually and you have a chance to have a house call with two of our doctors. So many things going on with our cases, hospitalizations, the Omicron variant. We will cover as much of that as we can in the next hour. I would like to, because there's so much going on, we have both of our Cook County Department of Public Health co-leads, Dr. Rachel Rubin and Dr. Joshi. So please know that this is an open forum. We're going to have people that come in and out throughout the next hour. We're going to field your questions. We're also going to just download you with as much information. And we know that some of you are watching this on playback. You're not watching it live. So welcome to those of you who might be watching it tomorrow morning or the next day. And we're just grateful that you trust us for information, and we hope that you'll find the next hour very informative. So let's get started. I am going to let each of our doctors introduce themselves, and then we can jump right into our conversation. And just know this is a pretty informal presentation, if you will. They are going to give you some updates right away, but we don't have any slides or anything like that. We're just going to be talking with you tonight, and think of this as a casual house call with a doctor. And I don't know how often we get to do that. So first I will let Dr. Rachel Rubin introduce herself, and then she can turn it to Dr. Joshi to introduce himself. Dr. Rubin?
Yeah, hi. Thanks, Denise, and thanks to everybody that have joined us this evening or on the recording later on. So I'm Dr. Rachel Rubin, and I'm a senior medical officer and one of the co-leads of the Cook County Department of Public Health. And I'm happy to be here with my partner in crime, Dr. Joshi. So the reason we wanted to have the two of us here with you together at the same time is because, as most people know, on Monday, our mitigation order went into effect, our latest mitigation order. We've had a mitigation order related to indoor masking for everyone, regardless of vaccination status, since this past summer. And we added on to that, going into effect just a couple of days ago, that restricts only those that are proven to be vaccinated into establishments that serve food or drink, and also for establishments for fitness activities. We built into that guidance, that order, that children or young adolescents and younger, 18 years old and younger, that are involved in sports-related activities are exempt from that order, because we are expecting them to follow the state's all sports guidance from the Illinois State Board of Education that provides a certain level of protections. It also means that everybody needs to be masked at all times, except when they are eating or drinking. So there are a lot of different questions that I'm sure people have about that. But the basic point is that we're trying to keep everybody safe. We're trying to save lives with this added mitigation, because our numbers of cases, and right now we're in a surge of both Delta and Omicron together, are extremely high. We're seeing in suburban Cook County about 5,000 new cases a day, as is the city of Chicago. So that makes it over 10,000 to 12,000 new cases diagnosed every single day. And that's enormous. So it's creating enormous strains on our public health operations, but I mean our hospitals and our clinics. And so we needed to do something to try to get people in the best, safest situations as possible. So I'll leave it at that, and Dr. Joshi can add on to my comments.
Thanks so much, Dr. Rubin. Thanks to everyone out there who's watching right now and maybe watching the replay. I'm Kieran Joshi. I too am a senior medical officer and co-lead along with Dr. Rachel Rubin of the Cook County Department of Public Health. Just to remind everyone out there, we are the health department for suburban Cook County. And so a lot of our comments will be specific to our suburban jurisdiction. As Dr. Rubin mentioned, I think our major concern right now is what we're seeing in the hospitals. We're seeing day over day increases in the number of people that are hospitalized. And just as a measure of how severely ill people are becoming from COVID-19, a decrease in the number of hospital beds that are available in intensive care units. So we've seen, globally and in our own country, what happens when healthcare systems become overwhelmed. And I think we're really kind of teetering on the brink of that right now. So it behooves all of us as members of the suburban Cook County and Illinois community to follow the good public health guidance that we've been discussing from the very beginning of this pandemic. Which of course, I think as everyone knows, is to wear a mask, watch your distance, to get vaccinated, and to get boosted as you become eligible. Thanks.
Excellent. So I know that you both talked a little bit about some of the mitigations, but I would love to dive into a little bit more detail in terms of the new mitigation that took effect earlier this week. The restaurants, exercise facilities, classes, entertainment venues. I would love to know what was behind that. And it's funny, yesterday my son accompanied me to work downtown and he went out to eat and he reported to me just before I got on here that every place that he entered yesterday asked downtown. So that was good. That made me feel good that like Urban Space, which is right around the corner from our office, and at the Illinois Center in the food court, like in both those places, he was approached and asked to show his vaccination. So I just would love, it's good to hear that it's actually being delivered. But I want to hear from you all, what were the precise factors that sort of went into that decision, and how did we, how did we come to that?
Maybe I'll start with some of the rationale, and I'll let Dr. Rubin speak to the particulars of the order itself, as she was, I think, very closely involved in the crafting of the order. So as I mentioned, we're really seeing increases in hospitalizations, and we see one of our primary objectives to be to protect the healthcare system for the reasons that I mentioned earlier. We want the system to be available and able to absorb a number of different people, or people who may be severely ill. If you have a heart attack, you want the hospital and the healthcare system to be there for you. You don't want to be fighting for ICU beds with somebody who maybe has COVID. That is, I think we can all agree, that is not a good situation. So the purpose of the order is to really prevent that and to prevent unnecessary deaths. We know when people mask that they prevent themselves from acquiring SARS-CoV-2, the virus that causes COVID-19, and transmitting it. The evidence for that is incontrovertible at this point. And we also know that vaccinations are incredibly safe and incredibly effective. You are so many more times more likely to become severely ill and be hospitalized if you're unvaccinated as compared to someone who's vaccinated and boosted. So let me stop there and turn it over to Dr. Rubin to speak to the particulars of the order.
Yeah. So some more specifics about the order. First of all, the order restates the masking requirements, which are that everybody must be masked in indoor public spaces, regardless of whether they are vaccinated or not. based on the evidence that we know that masks keep you safe. It keeps you especially safe that if you are positive with a COVID case, symptomatic or asymptomatic, that it will stop you or greatly decrease the likelihood of you being able to transmit it to others. And in addition, a mask will protect you from getting it from somebody else. So we know that. And then the other part of the order is adding on requiring vaccination proof for anybody from the age of 5 years old and older going into any place that serves food and or drinks. So that includes restaurants, bars, snack locations that have sit-down spaces for eating in grocery stores, like the Whole Foods or where you get the famous hot dogs in Costco, that if they still have tables and chairs there for people to sit down, they cannot sell you that food unless you are taking it for takeout. So that's one area. It's any places that serve food and drink. So it's a stadium where you're going to see a performance of some sort. The only way that you can go in there without having vaccination proof is as a spectator, is if they do not serve food and drink. So they close the concessions. And this includes what we're talking about are the patrons of these establishments. And the second kind of establishment, I'll talk about workers in a quick second. And the second thing also has to do with other kinds of entertainment venues that serve food or drink. So that includes bars and event spaces, concert venues, sports venues. And then also we have this also includes fitness centers, fitness locations, so fitness clubs. And this also includes workout locations in hotels and restaurants. So you don't need to show proof of vaccination to stay in a hotel, but you do to enter the restaurant in a hotel and to enter the fitness center in a hotel, as well as the larger fitness centers in our communities. This also includes fitness centers that might be located in other spaces, such as a community center. However, as I mentioned before, we have exempted from the physical activity part of the order to anybody 18 years old and younger, because they are to be following the all sports guidance from the Illinois State Board of Education. And we don't want, and schools are also exempted. So schools are exempted. Children involved in fitness activities, including sports, 18 years old and younger. And also anybody that has a known medical exemption to the vaccine of whatever age, such as an allergy to the vaccine. So that's for patrons of these establishments. For workers, because this is going along with OSHA regulations, especially those that are forthcoming, is that workers, and we're not talking about healthcare workers that may work in institutions where vaccination is required. Workers can either be vaccinated and show that proof of vaccination to their employer, or if they choose not to show that proof, or if they are not vaccinated, they have to have testing for COVID on a weekly basis. And this can be an antigen test, like the home tests, or it can be a PCR test. But even if it's one of these rapid tests, I shouldn't say home test, rapid test, it has to be done at a place that can document that this test has been done under the appropriate conditions. So therefore, you can go to your local pharmacy and you can get a rapid test. You don't have to wait for a PCR test that may take a matter of hours or days to come back. You may use a rapid test, but one that is administered by a person that's been trained to do that. In many locations now throughout our jurisdiction, they are fairly readily available. And the type of Documentation that can be shown for proof of vaccination can be your vaccination card. It can be where you've downloaded that information to an app such as the Clear app or the new app that the state of Illinois has just put online that keys into your full vaccination record, but it pulls out of there your COVID results and puts it into an app. It can be a photocopy of your, on your camera, a photo of your vaccination card. You can tell how old I am. Your vaccination card. It can be documentation that you've gotten from your physician's or provider's office that shows that they have ordered and have given you the vaccination. I know that some institutions don't give a card, but they give you a vaccination record, like you might get off of your MyChart, for example. So any of those are acceptable. You're also saying that if you're 16 years old and older, you have to show another piece of documentation, ID, that proves that the name matches with the name on your vaccination record. So it doesn't necessarily have to be a photo ID, though that's preferable. It doesn't have to be a photo ID. It could be a work ID, a school ID, a utility bill that you have gotten in your name at your address from home. So that proves that you have some other piece of ID that proves that you are who you are. And I think those are more details than you need to know at this point, but this is on our website at cookcountypublichealth.org. The order is there in stark relief. So you may look it up and you can see also a whole list of frequently asked questions that will probably answer a whole bunch of things that we don't get to tonight.
Yeah, and we actually thank you for those of you who are in the chat we are getting comments and questions. And so on the same note of what we were just talking about, the new mitigation related to restaurants, eateries, and all of that in terms of being able to prove your vaccination status, there is a question from Jessica about how do we justify not recognizing religious exemptions? Because you did mention something about allergy, you mentioned that about allergies, but you didn't mention about religion. So if either of you would do that, and then actually I'll introduce myself because I just realized I'm on the Cook County Public Health Department channel, where y'all may not know who I am. On the regular Cook County government, I don't think I have to introduce myself, even though I should every time. My name is Denise Barreto. I'll tell you more about me in a minute, but we are diving right in. And so that question is, how do we justify not recognizing religious exemptions to this medical? Because it says, it has some more details you could read, but the main point is you mentioned allergy, but you didn't mention religion. So how do we justify that, or how does someone show that, and are they permitted anyway?
I think that the state of Illinois has made it clear, and the CDC, that there is no recognized religion that prohibits vaccination. And so we are going along with that particular mandate to say that there is no recognized religion that prohibits vaccination. These vaccinations, especially the mRNA vaccinations, are not used with any human cells. And I know that has been a particular concern of some individuals. The Pope and the major religious leaders of all major religions have said that please get vaccinated, and that there is no religious edict that says you should not be vaccinated. So that is what we are following.
Well, and on that, Dr. Joshi, I don't know if there's anything you want to add, but there is actually a question that's kind of a part two to that from Tatiana, that is there somewhere where I can find all the ingredients or materials that are in the vaccination? And I think that's a great question, and a great follow-up to the question we were just having, because we know that some of the religious concerns centered around human cells and things like that. You did address that, but just Tatiana's question, is there a place where we can find that?
I think the best source of information for that would be the FDA website. Each of the vaccines manufacturers have to produce extensive documentation that includes, all the ingredients, all the reasons to use any kind of medication, including vaccines, obviously for prevention of COVID. along with any reasons not to use the vaccine, so any contraindications, and all the ingredients are listed there in gory detail. And we can share that either in the chat or make it available on our website, the specific links, that is.
Awesome. Thank you. Thank you. Thank you. So I will take a quick second to introduce myself. My name is Denise Barreto. I was all about business tonight. I've got a great dinner that's waiting for me when this is over. So I was very focused on getting us in and getting us to talk. But my name is Denise Barreto, and I am the Director of Equity and Inclusion for Cook County Government Offices under the President. And we have been in partnership with the Cook County Department of Public Health from day one in making sure that we get information out. We're sharing this in our channels as well. And my work at the county, I've been there 19 months, really centers around equity and figuring out equitable solutions to close health disparities, as well as help us to invest in areas that have been historically excluded and making sure that we right the wrongs that government has been responsible for putting in place in a lot of cases. So that's who I am, and that's why, and I think my familiarity with Department of Public Health is because I've talked to them multiple times a day for like almost a year straight. So it's like all these people have to know who I am, but I know all of you in the audience may not. So thank you for bearing with me and letting this woman just start us off. We do have another question, not related necessarily to the mitigations, but comes from Sherry about the department creating open communication platform for vaccinated folks to report side effects and help seek compensation. So that seems like that's a question I've heard about, like, is there some place people can go to see a group so we can see what side effects people have been experiencing? Is there some place that they can go? And I don't know much about the seek compensation, but I'm throwing it out there for you all to respond to. Thanks, Sherry Saunders, for your question.
Well, first of all, that there is the CDC has set up a very easy system for anybody to report side effects or adverse reactions from the vaccination. We can hunt around for that link for you and put it in the chat before the end of this broadcast. I forgot the name of the site, but anybody can go in there and report their side effects. And in fact, it's recommended that individuals do that, as well as medical professionals who you may have spoken to about this, to put in these adverse reactions, these side effects. There are many open communication platforms that I've been seeing, frankly, on social media where people do share this information with each other all the time. I don't think we have plans to put one up on our health department website. And in terms of where one can seek compensation about that, I really don't have information about that. I would imagine that would be via the manufacturer of the vaccine, maybe their website. Maybe Dr. Joshi has something to add about that.
No.
Just one comment. The vaccine adverse effect reporting system for COVID that was developed for COVID specifically is called vSafe. And yeah, we can share that in the chat.
Awesome. And Sherry also put in a couple of other comments, one related to a church, Native American church in Alabama that has a religious exemption. So I think folks, you can look in there and see that. Hold on a second. We have another, I have some other questions prepared, but I'd rather get all the ones of people who showed up here with us first. So that, first of all, I want to tell you some thank yous. We had some thank yous from Amy and a couple of other folks, I think it looks like Jean, thanking you for your experience and the commitment to the community. And I feel like as much as the questions, we want to make sure that we give people their roses, right? We want to make sure, because it's not often that people take the time to thank us who have been working on this all the time. So I wanted you to know that you got a couple thank yous out there. Amy, who also thanked us, says, will you share the current contact tracing efforts, and would you share an update on pediatric hospitalizations in Cook County? So thank you, Amy, for that question. And either of you would love to, you can dive in onto, it's actually two parts, right? One of it's about the contact tracing, but also about pediatric hospitalizations.
Why don't I take the first part and I'll leave the second part to Dr. Joshi. So about the contact tracing efforts, our contact tracing efforts are still going forth, but as you can imagine, with 5,000 new cases a day, we cannot contact everybody, and people should not expect to be contacted. A couple of things have changed over the last couple of weeks, actually. One is that the state of Illinois is now pushing out a text message to anybody who has tested positive, specifically with a PCR-based test, or if they are being tested as part of a group program, like through a school using the antigen tests, because they go into what's called the lab reporting system, the electronic lab reporting system, which then branches over into the surveillance system for COVID itself. So now what's happening is that individuals that are testing positive for COVID, if they have left a cell phone number in their contact information when they have the test done, they should be receiving a faxed notice saying that if you want to be contacted and if you're willing to be to discuss your situation with the health department, then that is your option. And then there are options to be able to provide information, for example, how you're doing over the following few days, that there's ability to do that even electronically. That being said, we are still getting lists every single day of anybody that has turned positive, and we have to prioritize those lists, right? So that means we try to pick out of those lists people that live in long-term care situation settings, such as group homes, nursing homes, assisted living situations, who live in congregate settings, such as homeless shelters. So people, if we know that they are living in those kinds of situations, we know that the opportunity for spread is much more than if you're just living in a single family home or apartment with just a couple of other people, or even more than that. But the idea that you're living in a space with a lot of other people, or where there are caregivers, like in a long-term care facility, you may live in your own apartment in assisted living, but there may be caregivers that are going from room to room or apartment to apartment. So we know that the spread in those situations can be much faster, and it's also more vulnerable populations, people that have either they're older or they have underlying medical conditions that put them at higher risk for complications. We also are prioritizing people that are hospitalized and trying to contact trace them. So people shouldn't expect to be getting a call if they test positive and they're basically young and otherwise healthy and are having a very mild case. But if they have left a cell phone number, they are likely to get a text message about what to do next related to contact tracing. So those efforts are still going on, contact tracing, every day, all day long, but now we're having to prioritize to the higher risk areas. Schools are another area too. Anytime we hear about cases in schools, we investigate those, working with school personnel to do a lot of that work.
Yeah, and I was going to say a lot of individual school districts, like literally a couple of weeks ago, my son, we're in Cook County, we're in a different Department of Public Health with Evanston. However, there was absolutely, anytime he was exposed, the school was part of the contact tracing. So the other thing, what that's just to kind of prop up what you were saying, that in addition to our efforts, we are working with folks who are also doing it within either organizations or other systems. Contact tracing is absolutely still happening. It's just that it isn't necessarily all being coordinated through our public health department. Dr. Joshi, will you do the update on the pediatric hospitalization?
Yeah, sure. Thanks so much, Denise. Yeah. So in brief, I think as most viewers probably know, children are much less likely to experience severe illness from COVID-19 as compared to grown-ups. In fact, if you were to look at the graph on our website, and we can also share a link to that, it's like basically a staircase, and you can imagine a step for every additional decade of age in terms of the rate that people are hospitalized in suburban Cook for COVID. So again, it's stepwise by age. Your risk of hospitalization or severe illness goes up. That has not changed from previously.
Awesome. So I have Jean. First of all, Jean's made a comment and a question. So we're going to first I want her comment, which is going to be too big to get in there. But Jean says, we need more drive-up vaccination shots in the Chicago area and suburbs. Many people who are high risk or immunocompromised are afraid to go into a crowded grocery store or pharmacy due to the highly transmittable Omicron variant. So she references the IDPH state drive-up site in Arlington Heights and Aurora, and how it's been a great service, but it's really been limited. And look, I know even I don't know all the suburbs exactly, but I know where Arlington Heights is versus Aurora, and that's very far, and it's few and far between. And yes, it's winter. So her question was, it's not really a question, it's we need to get the word out about those sites and expand them. Do you have any comments to that, about that idea? And then I'll jump to Jean's other question. Thank you, Jean, for your patience.
Thank you for your question. First, I'd say with respect to drive-ups, absolutely, we certainly want to do that. I think it's a great way of running a vaccination program. As you can imagine, cold weather, snow, things like that make it challenging. Chicago comes with its own set of issues here, right? So that said, we are aware that it's difficult for some people to leave their homes, and we will come to your home and vaccinate you if you are challenged in any way. So if you're interested in that, please go to vaccine.cookcountyil.gov. Again, that's vaccine.cookcountyil.gov. And there's a button on that website. It's in the upper right side of the screen. And I think it says something like home vaccination, sign up, click that button, sign up, and we will get somebody out to vaccinate you. In the event that transportation is a barrier for you, we can also assist with that. There's a phone number on that same website. And again, we can share that shortly. You just have to call that number, and we will get you from point A to point B being anywhere you can get a vaccine.
And we will make sure that we put that in the chat, just so you know. And I believe to the question earlier that I think Sherry had a follow-up about the manufacturers and the vaccine exemptions. Just so you know, there are a couple of resources that we are getting into the chat to follow up on that. Jean's second point, which I think is a really good one, and one that's not really, again, Jean is dropping coins of wisdom, not necessarily asking questions. Jean says the IDPH website shows that 97% of new COVID cases are Delta versus Omicron. Can we talk about that a little bit? Because right now, and Jean correctly goes on to, well, actually, Jean does ask a question. Is this correct that the majority of cases in Illinois are still variant as IDPH, or is there a mistake in their reporting? And then she basically grabbed the report from January 5th that shows the cases, and Omicron is only 3%, while Delta is like 97%. And so I think that's thank you, Jean, for highlighting that, because I think there's so much confusion. And then I don't know about you all, but I saw a headline right before I was started here about the Florona, that whole flu and corona mix being identified in California. So there is so much information. I think it's hard for people to be able to delineate what's real and what's like fake or what's hype. And so would you please answer Jean's question, which is it correct that the majority of cases in Illinois are still Delta versus Omicron, or is there a mistake in their reporting? Thank you, Jean, for that awesome question.
Yeah, I don't think that there is a mistake in the reporting with respect to what the state of Illinois knows at this point. Right now, there's very few specimens being genotyped, so being sequenced, so we know what kind of variant it is. The state lab is working around the clock to sequence as many specimens as they get. There are a whole group of hospitals whose labs have been deployed. I mean, the labs have been able to step up their own sequencing as well as some commercial labs. And so these are being reported, but only a very small handful, under 10% of the positive specimens are being sent on to be further sequenced so you actually know what variant it is. Also, there's a lag in reporting. So if the state says that it's 90% Delta right now, that reflects the way things were last week. And we know that Omicron doubles about every 2 to 2.5 days. So if you see 10 cases today of Omicron, in 2 days, you're going to see 20. And then in 4 days, you're going to see 40. In 8 days, you're going to see 80. So it multiplies, right? You got to remember your algebra and your geometry, right? So it's exponentially increases. It's doubling time is every couple of days. Delta is a little bit slower. It's 3, maybe 4 days where it doubles. So we know that very quickly Omicron is going to overtake Delta. And I wouldn't be surprised if by next week, the state of Illinois will be reporting that Omicron might be closer to maybe 30 or 40% compared to Delta. And that again is based on a pretty small sample size. So that you have to put it in that context as well, that there may be some underreporting. Also remember that there are a whole bunch of cases out there. We now, the data is coming in stronger and stronger every day that it looks like Omicron is causing, especially amongst people that are vaccinated, but even not, that Omicron is causing a milder disease. So if people are doing home tests, which are really a great idea, but if they're doing a home test and they're feeling lousy, and we are saying, please don't go into the doctor unless you really need to. Please call your doctor first. Don't just show up in an emergency room because you want a COVID test. Don't go to an emergency room for a COVID test. If you're doing a home test, you turn positive, and you're feeling lousy and you're under the weather, hopefully you're doing the right things by isolating if you're positive. And now the new rules are for the general public, different rules for healthcare and for long-term care facilities, but for the general public, you isolate for 5 days, and for another 5 days, you wear your mask all the time, indoors, outdoors, in your home, outside your home. So that full 10-day period, you're protected by wearing a mask, but the first 5 days you are in isolation. You keep yourself safe. And if your symptoms are gone or greatly improved by day 5, no fever, or by day 6, you keep that mask on even if you're going out. And if that's never been reported, then we won't know. And it might very well be Omicron, especially since it's a milder disease. And the more severe cases are the ones that are going to show up at the hospital.
You said something, and I apologize for my ignorance. You said something about sequencing, and I was like glassed over. What do you mean by that? Well, and I'd say that because if I'm glassed over and I'm talking about this every day, all day, then what are these people who don't, they're not sitting in meetings all day hearing about it? How, I just know as soon as I heard that, I was like, so tell me what you mean by sequencing, like, or what's the layman's terms of that? Is that like a segmentation of it, or like what do you mean?
It's looking at the genetic material and looks at the different kinds of mutations that are occurring in that viral RNA. So it's looking at the genetic material of that virus, and it's an RNA type virus. And they look at that genetic material and they can determine what kind of mutations are occurring in that, and that based on where the mutations are and what they are on that spike protein, as well as other parts of the virus, that's how it's determined what kind of variant it's called. And so they have to do that with very specific microbiological techniques, and it's called sequencing or genotyping. And that's what allows us to know what kind of variant it is.
I love that. And and basically for those of us who aren't doctors, that's just like a deeper examination, right? You're basically saying it's a deeper examination of the RNA. So thank you for giving us that microbiology lesson. Let me see, there's a couple other, first of all, I want to point out that for those folks who asked the question, I think it was Jean earlier, or someone about immunocompromised folks, we did now put in the chat how you can go in there and figure out if you need us to bring a vaccine to you, or if you have any questions, or you have some hardship around transportation. Absolutely. Thank you for putting that up. I wanted to highlight that some of the things that they said are in the chat. So in case people, if you leave and you're not here, or you're watching it on you're watching on replay, it's now up there. And this is helping you schedule rides, request child seats, like anything related to transportation. We just put that up for you. Let's see, thank you. First of all, thank you for having such an active chat. Like, I love that because it makes this time go by so much easier than us trying to figure it out. Carolyn says, am I correct in understanding that clients of a healthcare facility are required to be vaccinated or medically exempt, but the employees, trainers, coaches at the facility have no such requirement, as they're only required to submit to weekly tests? Very good question, Carolyn, and I'll let the doctors answer.
It's out of a health facility. We're talking about a fitness facility.
I think we need to take that as, yeah, because when you see employees, trainers, coaches at the facility, and Carolyn, if you're still here, please drop something in there. But that's a great point, Dr. Rubin, is health facility is different than a fitness facility. Even though it's wellness, it's not necessarily the same as some of the health places that you talked about before. So Carolyn, if you're still here, please let us know if we're getting the question right. But based on the way it's written, right, because it says employees, trainers, coaches at a facility have no such requirement. Is that true? You know, even so, call it let's not say health facility, let's say wellness facility, while we wait to see if Carolyn comes back. Is her question, is it different? It's different, right? Oh yeah, that's what she said.
Yeah,
Carolyn.
It's different. It's not even all wellness facilities. It's those wellness facilities that have exercise, right? That have physical exercise going on. And the trainers and the staff there, the employees, we greatly, greatly, greatly encourage them all to be vaccinated and to be boosted, because that's the safest thing to do. But they are all required to wear masks at all times. We know that when you are vigorously exercising, more of the virus can get out into the environment and around the sides of your cloth masks or surgical masks. And you can't it's very, very hard to exercise in a respirator, in an N95 respirator, right? And so a lot more of the virus from people that are vigorously exercising can get into the air. It's unclear what kind of air circulation and air quality there is in a lot of these facilities. And the employees have to be masked at all times. And by OSHA guidance, they can opt out for testing once a week. And they have to show that testing result to their employer. Private employers are certainly allowed to put up regulations or rules for their workplaces that say all employees must be vaccinated unless there is a major, contraindication risk for them being vaccinated, right? And we are hoping that private employers would do that, because that is the best way to keep their employees safe. But in terms of the bottom line is that workers can show proof of a negative test once a week or be vaccinated, fully vaccinated.
And Carolyn added something, because park districts are their governing body. They're like, they're quasi-government agencies. So Carolyn's, concern there is about aquatics, youth swim lessons. Disabled adults are being taught potentially by unvaxxed trainers. So what you were saying about the testing is part of is part of what you're saying, correct?
That's correct, right.
Awesome. So I have a question that is related to our south suburbs. That we know that when you look at the maps and where folks are not vaccinated are really being ravaged by the disease and the virus, it is on the south suburbs, which are within our jurisdiction. Can you speak to what we're doing to try to help that area specifically, as it's one of our historically excluded areas that I referenced in my intro.
I think, thank the viewer that raised this question. It's something that's really important to us as a health department that's really focused on this idea of health equity, which is ensuring that everyone has the same opportunities for health. And sometimes that means that we have to spend more time and more resources and energy in places that have historically been disinvested or experienced problems like racism disproportionately. And we know that that's the case in a number of suburbs in the Southland. I don't think that the reason that we've seen such high rates of COVID in the South suburbs and in some of the West suburbs as well is something that arose just because, right? There's a whole bunch of historical reasons that have led to the people, the communities in those suburbs having less access to resources like healthcare, right? And some of those same problems, some of those same issues have resulted in higher rates of COVID. For example, if you're living in poverty, you're much more likely to, potentially have a job that's precarious, that's a low-wage job that does not have paid sick leave. So if you don't have paid sick leave, how can you stay home, right, when everyone is on lockdown? If you don't have paid sick leave, it's a risk for you to go out and potentially get vaccinated because you're worried about that next day where you've heard that people might feel ill. So I don't say that to say that people shouldn't get vaccinated. By no means, please, don't hear that. It's just that I think that, we have to acknowledge these barriers and work really hard, harder, I would argue, than we've worked elsewhere to overcome them. So to that end, our agency has spent a lot of time trying to address the barriers that we can. I mentioned some of the stuff we've done around transportation earlier. And then we've also done a lot of intentional community outreach and community engagement in partnership with community-based organizations that are working on the ground, that are the trusted members in the community. So in some cases, that's been community health centers. Family Christian Health Center in Harvey comes to mind. They're a phenomenal organization. And then there are others that provide social services or supports of different kinds that we've partnered with to, again, both get our messages out or to co-host vaccination clinics with. Over the course of this pandemic, we have held hundreds of vaccination clinics, I think over 400 at this point, maybe approaching 500. And I believe we have delivered over 45,000 doses into arms. And these are all clinics and all vaccinations delivered to some of our most vulnerable residents. And I'm really proud of that work. And at the same time, I acknowledge that much, much more needs to be done.
Yes, thank you very much. We have we have about 10 minutes left, and we have three really, really good questions. I'm going to start with Gabriella Reyna. First of all, Gabriella sets up a situation that I think is really common, right? If I'm the first person that's tested positive and the rest of my family also gets infected, develops symptoms days after, am I okay to go back to work? Since my 10 days have already passed, or do I have to wait till all family members have tested negative? Thank you in advance for your answers. And that's a really great question, because when you're in these households that have overlapping folks, right? So what do you say to Gabriella's scenario that she set up?
Yeah, it can be really complicated when you have one person getting sick and then another and then another. If you're, as we say, patient zero, you're the first person in your household to test positive. Finish your quarantine, your isolation period. If you're feeling better, no fever anymore, you're good to go. You may go back to work. If you get, we do know that people can get COVID more than once, but you're not going to get COVID right away again immediately after you have just recovered, right? You have a certain period of time that might be weeks, it might be months, it might be longer than that, it might be several months before you're at risk of getting COVID again. So if other people in your household are sick, and assuming they got it from you, so they're going to have the same variant, they're going to have the same kind of COVID infection as you, it's more tricky understanding when the rest of them can get out of quarantine, out of isolation. For anybody that tests positive, their time clock starts from the time that their symptoms started, or the time that they tested positive, whichever comes first. And I don't mean the time that the test came back, I mean the time that the test was taken. So Gabriella, let's say you became sick 8 days ago, and 5 days ago, your partner got sick. Their time is going to start on the day of those symptoms 5 days ago. Now, if they were asymptomatic, but they were getting tested anyway because they knew they were exposed to you, then it would be on the day that they get tested, whatever day that may be. That's when their count starts. And then for people in the household that didn't get sick, but they're still living there with you, even though you're isolating, you're keeping yourself away from them, that gets even a little bit trickier. Then we hope that they get tested, and the recommendation is to get tested 5 days after the last time they're exposed to you. So let's say you get tested, Gabriella, 10 days ago, you've been keeping away from everybody. We hope that 5 days after that they go ahead and get tested, that they either are staying somewhere else or at least are not continuing to be in contact with you day after day while you're recovering. So they get tested, they test positive, then they start at that point. But if they don't test positive, it's good they test on day 5, and hopefully they will continue to be very careful for the period of time that they need to be quarantining. And quarantine refers to when you're not sick and when you're not testing positive. And so it's got to be from the last day that they were exposed to you. So if they continue to being exposed to you while you're recovering in those first 5 days, first 10 days, that's a problem. So the idea is to keep themselves away from you, because the clock will start at the last time that they're exposed to you, and then it goes out. The new guidance is it's a 10-day period for quarantine. The first 5 days you stay home. The second 5 days you can go out, but you've got to wear a mask. Get checked at day 5. And that's only if you're not vaccinated, right? So we're talking about if they're not vaccinated when they've been exposed to you. If they are vaccinated, they can go out for that 10-day period, but they've got to wear masks the entire time.
Wow, thank you, Gabriella, for that very detailed question. And then thank you, Dr. Rubin, for addressing, and you know what, I will say, that's the hardest part about this, is that mental, getting our head around, the clock is ticking for this, the clock restarts for that. And what I would say is to be gracious to yourself and the people that you're living with. And yes, make notes, right? I'm 50 years old and I would not be able to keep that straight. And it's just me and my 16-year-old here. All right. The last 2 questions, and we're going to end up going over, because these last 2 questions are really good and I don't want to miss them. And I am going to miss a couple questions. So the next one comes from Kathleen Bickle, and this is one I have not seen. So I thank you, Kathleen. mRNA vaccines are helping lower severity and death rates, but don't seem to be preventing infection and spread very well. And so don't infer, durable protection that requires frequent boosters. It seems the solution, we are currently experiencing high rates, spread, such and such, et cetera, et cetera. Should traditional non-mRNA vaccines be re-examined? Would they be better working or working better? Thank you, Kathleen. What a great question.
Thank you, Kathleen, for your question. I think it's a good one, although I do take issue with the premise. I don't know that it's about vaccine mRNA versus non-mRNA. I think it's about which vaccine works and which one doesn't. And I say that because just this past week, There's a scientist named Peter Hotez from the Baylor College of Medicine, one of my heroes. This guy and his team developed a vaccine based on older technology, easy to store. The guy did not patent it, right? He's not going to make a dime off of this vaccine. And its intended use is to allow for vaccination in countries all over the world where, you know, maybe they don't have these ultra cold freezers that are sometimes required, right? So back to your question, what is the issue with the vaccines and why do they not prevent transmission? I confess here, I think we as public health did not do a great job in terms of communicating what the vaccines were really intended to do. I think it's great if they stop transmission, and I really hope that they do. But the end goal to me is to keep people out of the hospital and also to keep them out of the funeral home. And it's clear that all vaccines, specifically the two mRNA vaccines that you mentioned, have continued to perform fairly well against those goals.
Awesome. All right. The last question, but I do want to acknowledge something that Sherry put in the chat. Dr. Joshi, you said gory details on the vaccine of ingredients. People aren't liking that language, so I just want to give you. I just want to let you be mindful of. Be mindful of gory details because I think you scared some folks. But Sherry didn't leave; she stayed around. She stuck around. Thanks, Sherry. Thanks for letting us know, because language does matter, and we absolutely appreciate that. So, Jean, you have the last question. Jean said, "Is there any talk on when the fourth COVID vaccine doses will be approved by CDC for immunocompromised adults? Many received their third dose 4 or 5 months ago, so vaccine protection is lower." And I don't know how accurate that timing is, but I think that's a question that's on everybody's mind anyway, right? Like now that we are starting to push the third dose, of course, this question is centered on immunocompromised, but I think this represents a bigger question that people are having about fourth doses, but starting with our most vulnerable. So thank you, Jean, for that question.
The fourth doses are approved now. The fourth doses you can get now because what's being called a third dose or an extra dose is considered part of your primary series if you are in this immunocompromised group. So that means after you get that third dose, that's equivalent to somebody else getting 2 doses of the Pfizer or the Moderna. You needed 3 to be able to get your body to respond to the vaccine and to build up some antibodies. So now 6 months, and the CDC said 5 months as of this morning, is that it can be 5 months after that last dose, which in somebody who's immune compromised, that would be their third dose or their extra dose, whichever way it is called. We used to call them boosters, but we don't call that one a booster. It's called an extra or a third dose for people that are immune compromised. And it's not anybody who's immune compromised. It's people that are immune compromised with specific conditions like organ transplants, or you have blood-borne kinds of cancers like leukemias and lymphomas, certain kinds of chemotherapy, or if you're on certain kinds of immunosuppressing medication for a variety of reasons. It's not always for cancer. It could be for other kinds of autoimmune diseases that people may have heard of. So if you are in one of those categories and you received a third dose or an extra dose to try to get your body to respond and build antibodies up and a response after the vaccine, you are now eligible and you can go ahead and get your official booster as long as it's 5 to 5 months after that last shot.
So I'm sorry, I made a mistake. There is actually one more question, and it is from Sherry, and it's about community outreach related to, and I think it's a great way to end, and here's why. This question I meant to say like a couple times ago, but then other questions were coming in. But Sherry asked a question about community outreach being set up to educate people on how to treat this at home so that we can catch it and get the best outcomes. And I really was triggered to say this again, back when Dr. Rubin was describing in Gabriella's situation, right? When Gabriella, like when we were talking about, you know, we've both 2 times we've covered why the shortened, you know, being able to go to work after 5 days if you're not doing symptoms. And I think it's a great way to end, because Dr. Rubin also highlighted that some of us are taking tests at home and it's not getting reported. So that's why we have sort of an under-reporting of what's happening. So this would be a great way to end. Any advice you have for people, if you are testing positive, and you're at home and you're not, it's not severe, what can people do to treat themselves so that they can get back out there, you know, when they start to get better? What can they do to accelerate that?
Yeah, thank you so much for raising that. I wanted to make a point of lifting up this issue. So thank you for your question. In addition to the normal kind of cough and cold type stuff, or taking care of yourself when you have the flu, I want to make sure people understand and are aware that there are treatments coming out now for COVID-19 that are pretty effective. So there's a medicine called Paxlovid, also produced by Pfizer, and it is around the order of like 90% effective at keeping you out of the hospital or becoming severely ill. And while supplies are limited right now, I think it behooves people to be aware of that treatment option, because it's intended for people within the first few days of illness to prevent them from becoming so sick that they have to go to the hospital. So you have to ask for it early, is the bottom line, okay? So while supplies, again, are limited, and it's likely that it's going to be focused on people who are at high risk, so people who are older or have chronic medical conditions, I think everyone should be talking to their healthcare providers about this as an option. We are right now trying to reach out to healthcare providers in suburban Cook County to make sure that they know that they can prescribe it. But I think it needs to come from both directions. It needs to come from us, from providers, and then also from the public.
Awesome. Thank you so much, Dr. Rubin and Dr. Joshi, for joining us tonight and really just having this casual, I feel like this was a fireside chat. It's very, very freezing cold outside. And so I know I have my feet by a heater right now. And I really am grateful to have been your hostess, your moderator. I am thankful to Kathleen and Jean and Cherie and Gabriella, all the ladies who were in the chat, Carolyn, tonight, asking questions and helping us, because I know that there's going to be a bunch of people watching this afterwards. And so thank you to all of you who joined us live, and thank you to all of you who are going to watch this afterwards. And all the things that we referenced in terms of like going to our ccdph.org, our Cook County Department of Public Health.org. Everything that we've talked about is somewhere on that site. And so if you are watching and you want to rewind and go back to some of the references, they're there for you, as well as some phone numbers and things. And we are just grateful. And we know this is not the only time we'll be doing this. We just keep your eyes on our Facebook page, keep your eyes on all of our social media, as we'll let you know the next time we're opening up an opportunity to speak to our doctors. Thank you so much, Dr. Joshi. Thank you. Oh, thank you, Sherry or Sherry. I don't know if I'm saying it right, but thank you for being here this whole entire time. And I hope you all have a great, wonderful evening.